One.
Well, good morning. Welcome to the very first annual members meeting of University Hospitals Dorset NHS Foundation Trust. It's unfortunate that due to the continuing restrictions required in response to the COVID pandemic, we have to hold this meeting online rather than in person, and we all have hope very much that next year we'll be back to normal. I'm Philip Green. I'm the Vice Chair of the Trust, and I also hold the position of Chair of the Audit Committee. David Moss, our Trust Chair, sends his apologies as he is unable to be with us today. Shortly, you will hear from Debbie Fleming, Chief Executive, and Pete Papworth, Chief Finance Officer, reporting on the first 6 months of the new Trust. There will also be a presentation from Sharon Collett, the Deputy Lead Governor. Following their presentations, there will be a chance to respond to questions that you have submitted in advance of the meeting or that you submit during the meeting by using the facility showing on your screen. You may submit these questions at any time during the meeting, but it will not be possible due to the nature of the technology to ask questions of presenters during their presentations. The first 6 months of the Trust's existence, and indeed the period since March of this year, have been momentous. There's the merger itself of the Royal Bournemouth and Christchurch Hospitals Trust and the Poole Hospital Trust to form University Hospitals Dorset, which took place on the 1st of October 2020. There was a very significant amount of work undertaken by many people to reach this point, and since that date there's been no let up as changes brought about by the merger are being implemented. And the fact that all this has been achieved amidst a global pandemic with the incredible pressures that put on our staff is just extraordinary. We've also started to recover hospital services which were severely impacted by the large number of COVID admissions and the infection prevention and control measures which had to be put in place. And if this were not enough, the transformation programme is well underway with the alignment of services and the commencement of the estate programme with significant development at our hospital sites. Before asking Debbie to present, and I know she will touch on this point herself, I just wanted to take a moment to thank all our amazing staff and volunteers who have dealt with all the challenges they have faced in such an outstanding way. The board could not be more proud of what you have achieved. Thank you. And thanks are also due to you, the members and other members of the public, for the fantastic support which was given to our staff. Thank you. Now I'd like to invite Debbie Fleming, our Chief Executive, to present the annual report for October 2020 to March 21. Debbie.
Thanks very much, Philip, and good morning, everybody. I'd just like to add my welcome to you today. We're absolutely delighted that you've joined us, and we've been really looking forward to looking back together on the very first year for UHD. But interestingly, it's actually only the final 6 months of the financial year, so it's only the 6 months officially that we're reporting. But obviously, when we're looking back, we think of a number of things, and looking forward is very exciting indeed. We are very positive about UHD, and we're really positive about the future that we face together. But I did want to start by just saying that we are very much aware also still of the sadness and tragedy of the COVID pandemic. We have all been impacted by the pandemic, and many people have lost such a lot. We've all lost something, everyone's been impacted, but for some people it's been absolutely devastating, and we appreciate that. As people have lost friends and family, and we know that many of our staff have been really traumatised by what they've had to deal with on a daily basis with the pandemic. We recognise and we respect that. I wanted to say that at the start of today because for this particular event, we want to be looking forwards. We want to be focusing on the positives coming out of the pandemic and focusing on the good. But it isn't that we're not recognising the huge challenge that we've all had and still face going forwards. But I am going to focus on the good this morning because I'm really, really proud of our trust, proud of our people and how we've managed over the past year. And I am very excited looking forward as to the things that we can do together. Okay, so in that context, we've got our annual report out. For those who want to see the detail, the full report's available on our website, and it gives you, today we're going to give you an overview of that, and there's also a summary document that you can see. So if I can have a look at the next slide, really wanted to start the event by saying an enormous thank you. There are so many people that we want to thank, and we can't thank you enough. We need to say a huge thank you to our staff, our volunteers, our partners, and obviously all of those executives, the board members and our governors. Everybody has been involved in dedicated service. Everybody's been involved in ongoing commitment and hard work, and our public have really made a difference, and our members and all the feedback that you give us, we've really appreciated. So I'm hugely proud of Team UHD, and we're all part of that team. So a huge thank you to us all. So on the next slide then, just reminding ourselves of the 1st of October. It was almost a year ago now, but it's at that point when I look at those lovely pictures, and we were all wearing masks, we were all sort of keeping distance, but we were beginning to feel a bit positive. We'd had a good summer, the numbers had gone right down, and of course, almost immediately, almost as soon as we'd cut that cake, things started getting really busy, and we know that it was a very lively year. But we hold on to that picture, and we remember we started UHD full of optimism, and we remain optimistic. So next slide, please. And we're going to just have a little look now about what does UHD look like. Here we are, as we've now got established. We've been talking about merging since 2011. I think probably people started talking a bit earlier than that even, but official plans since 2011. So where have we got to? Let's have a look. So on the next slide then, so we own 3 sites from which we deliver care, the Royal Bournemouth, Poole and Christchurch hospitals. They are all 3 fabulous sites with excellent people who are really committed, doing great things for patients. It's also important for me just to say though that we employ a number of staff who work out in the community, and we've got staff who are based over in Alderney in our decontamination unit, and they too are fabulous. I really highlight these 3 sites because these are our 3 main hospital sites, but our staff are working in a number of places and connecting with primary and community services outside. So all great sites, and all of them with a really positive future. So on the next slide, please. One of the big messages is that everyone counts. There are lots of different people who make up Team UHD, and we're around 9,200 staff. We're a very large organisation, the 3rd largest now in the Southwest, and we're all getting used to the fact that we are very big, but we want to keep that family feel, and everybody matters. Every single individual working within the organisation is contributing to the delivery of excellent patient care. Next slide, please. So what are the services that we provide? Well, we provide just about everything that you'd expect a busy district general hospital to provide, and a lot of very specialist services. So we provide services for our residents that some hospitals don't. In particular, I pick out the radiotherapy service. We've got that based at Poole with a satellite unit over in Dorset County Hospital, all run by our staff. We've got specialist services such as head and neck and vascular and cardiac services. So there's a whole range, and there's not many things. If you enjoy working in these areas, we can probably offer something to most people who want a career in the health service. So next slide. And here's our board, and most of these people I think will be familiar to members, but they might know some better than others. So there's myself and David, who's really sorry that he can't be with us today. Then on the bottom line, that's my team, my executive team of directors. And then in the middle are our non-executive colleagues who are so incredibly dedicated and committed, and bring such a wealth of experience and interest from outside the organisation. So each of the non-executive directors, as you'll know, they're part-time, they're not employed by the trust, but they really make sure that we're making good decisions and bringing all the very best of knowledge from elsewhere to help us do that for our patients. And of course, we've got our wonderful Council of Governors, but Sharon will talk to you about those a bit later on, so we'll come back to those later on in the presentation. Okay, so on the next slide, we've got the board fully established. Very large organisation now, so we've set this up to be 3 care groups and then the operations group, and you'll see that with all these services and being so large, it's very important that we structure ourselves so that we can really stay close to the front line, and that we have good communications up and down and across the organisation. Each of these care groups is not a million miles off the size of a small hospital in terms of the budget and the number of people that are employed within them. So So you get a sense of how large UHD is now, and the challenge for us of making sure that everybody feels valued and a part of the organisation, which is a key part of our values. Okay, on the next slide then. So here we are, we came together, we've been thinking about this for some time now. We've got an established mission, we've got an established vision, we've got a very established set of values that we're working now to develop and embed in the organisation. So our vision is around positively transforming our health and care services as part of the Dorset Integrated Care System. Our journey is about change and improvement and development, and all of that is about doing that in conjunction with partners. So that's the vision for the organisation. Our mission is quite simple, really, to provide excellent healthcare for our patients and for the wider community. And we want UHD to be a great place to work now and for future generations. And then lastly, we've got the values, and these are so very, very important. We've taken quite a bit of time firming up the values. We've chosen 6 of them based on what our staff told us. These are the things that matter to our staff. And so these are the values that we recruit against. And these are the values that when we go into our appraisals that we're asking to see evidence of these values in everyone's day-to-day work. It's very, very important. And this is the thing that's binding us together in UHD. We share these values, and you'll see them behind me now, and you'll see them on all of our slides, because we're very keen to embed these and live these out in our day-to-day work. Okay, next slide. We have 5 strategic objectives. Again, they're very similar to the objectives of our 2 former organisations, and we want to do things really well, and we want to be a well-governed, well-organised organisation so that we can deliver a very challenging agenda of transformation. But very importantly, great place to work, use resources well, continually improving quality, whilst at the same time being a good partner in all that transformation work. Next slide. So this, I just want to pause on this one because we feel really pleased about having laid some great foundations for UHD. It's still very early days. The pandemic has slowed us down in terms of many of the things we'd have wanted to have achieved by now, but actually we've laid some great foundations. We have got this strong set of values that I've talked about, and we are embedding a very open culture, an inclusive culture, trying to keep everybody engaged and informed. We listen to our staff. Things don't always go right for everybody, but we really do listen, and we particularly want to hear from those from minority groups or different ethnic backgrounds or other people whose voice may not always be heard. We want to encourage them to raise concerns. We prioritise the health and well-being of our staff, and during COVID so much had to be done. Everyone was working under such dreadful pressures. We've always known, but we've realised afresh the importance of making sure that staff are looking after their own health and well-being, and that they've got packages of support to enable them to keep going. So that's very important for us. We've created a strong identity for UHD, and this is attracting more people to come and work for us and to come and work in Dorset. And we've got very ambitious plans for developing our workforce in line with some of these strategic changes. We're focusing on innovation, research and development as we develop the new university's hospital. And despite the pandemic, we've started bringing services together, integrating services so that we can start delivering benefits for our patients. And that's the journey that we're on over the next few years, to bring together more and more, integrate more and more with a view to doing things better. And at all times, we want to be outward focused in UHD. We want to prioritise strong relationships. We want to listen to our public. We want to listen to our members. We want to listen to our partners and make sure we really are the very best that we can be in serving local people. So next slide. And we're proud of all that we've achieved. I mean, I won't go through all the detail of this slide, but when I think about how dreadful the pandemic was, and thank you again for all your support, because it made such a difference to staff. We're very proud of maintaining emergency services during this time. We know that we've ended up at the end of the pandemic with very, very large numbers of people waiting, and we know they've been waiting for very long periods of time. But in all the priorities that we have to focus on, I think we prioritise in the right way around the emergency and urgent care. And I think when I look at our position compared with other trusts, we've done very well. We've maintained good access to services, particularly the urgent services and diagnostic services, and our cancer work I'm hugely proud of. We've addressed so many challenges as we've gone along with learning a lot about the COVID-19 infection, and we've addressed all those challenges as we've gone along. And again, I would note that many things were very, very difficult when the pandemic first hit. And we've learned from those things all the time. We've kept learning, and we are now much better placed to treat people with COVID. We're much better placed to diagnose it. We're much better organised in the hospital and with our estate to absolutely do the very best we can in terms of infection prevention and control. So lots of learning's gone on. And throughout the pandemic, we've tried to maintain high quality communications with our staff and our public. That's very important to us. Next slide, please. Just a few pictures there in the highlights, the fantastic Dorset vaccination programme, Dorset Research Hub based at the Royal Bournemouth Hospital, where we've been right at the heart of the research around COVID. The Armed Forces, our wonderful Armed Forces colleagues who came in and made such a difference for us in keeping services going. We were so grateful, and we've learned loads from them and them from us. And then, of course, staff supporting each other. And we know that that's been a key feature of the pandemic. And we've seen staff really, really go the extra mile in taking care. And our lovely Minnie, our ophthalmology matron, actually went to meet the Prime Minister as just one of the people, as a symbol of all the thanks that the government have wanted to give to NHS colleagues, and then particularly those from ethnic minority backgrounds. Next slide, please. So performance, I've touched on this, and if you, broadly speaking, we have done very well. The targets that you see there are the targets that are expected during normal NHS times. And actually, when I look at where we are on all those slides, we've done very, very well. Of course, the biggest area that's been damaged has been in the waiting times. Patients seen within 18 weeks. We were absolutely not able to maintain that. And there's been some slippage with the 62-day cancer standard. But our performance, we're very proud, actually. We've held up very well compared to others in the country. Next slide. And similarly, our whole approach to recovery. So everything is really busy, and it seems to get busier and busier. But we are still making sure that patients get the care and treatment that they need. We've done such a lot on recovery, and many of you have been interested to learn about the Think Big project that it's been in the local press and was launched yesterday. And you'll hear more about that if you join in on the open day events. We have seen lots of improvement already. We are not at all where we want to be with waiting times, but we're working very hard on it. And the Trust has managed its money well during this pandemic period, so that at the end of the 6 months, we have done what was expected of us, and we show an operating surplus for that period. But there's still much to be done, as you will hear. So moving on then to the future and looking ahead, and on the next slide, if we can move on, Zoe. We do have to recognise that there's an awful lot of challenges. These are the challenges that will be faced by all NHS organisations. The elective backlog and emergency pressures, the money, which Pete will talk about a bit later. Obviously, the workforce challenges, we do still have some shortages, and we know that hugely impacts on what we can do. Quality measures, there are some areas where we're just not meeting the standards that we'd like to meet, and we're working hard to improve that. All the challenges around digital infrastructure and what we want to do with the new ways of working that requires investment in digital. And then all the time, we've got this big reconfiguration and integration programme that UHD has got to take forward. So lots of challenges. But on the next slide, you can see we've made a jolly good start. Our plans have been led by our clinicians, and they've been developed for a long period. By separating emergency and planned care, we can do better. We know that. And aren't we fortunate we've got all this money coming in, over £200 million of money coming in to our patch that will enable us to transform our sites. We've now completed the merger, so we're really well placed to recruit and retain our staff, and with this university hospital status, which we're so proud of. And as a larger and more resilient organisation, we can use our resources to very best effect going forwards to provide safe, high quality care for local people. Next slide. And I just want to say there's a lot about this again on the open day. I'd encourage you to have a look at where we've got to. I would like to pay tribute to our strategy and transformation team, who throughout the pandemic never lost sight of the need to keep on top of the business cases we've been writing, the connection with all the decision making bodies to make sure that we got our capital monies. Thank you guys, because you did such a good job on that. And the work's all started. You can't miss it on our sites. The Royal Bournemouth has transformed outside. Paul work on the theatres as start, and also in Alderney and Christchurch. And all the time, we've got this culture of improvement, our quality improvement strategy, the Health Foundation work on working with them on innovation, developing the university partnership, and we're really proud of our work on the sustainability plan because we want to be a truly green organisation. So thanks everyone for your patience at all this, going through all this change. There is a, you can always keep in touch with the developments, the website's on there. So next slide. So in summary, it's been a very lively year. We continue to face lots of challenges, but we are better placed now to meet those challenges than we ever were in the past, and still compared with many other organisations. Working with our Dorset partners, we are looking forward to a very positive future for our staff and our patients and local people, and that feels really encouraging. So I've got 2 more slides just to show up for you. One is just to say about the annual report and the summary, which is available. You can go find that on our website. And the last slide is just to leave you with some pictures of our amazing people. I could not be more proud to be Chief Executive of University Hospitals Dorset. It's the people who make the place, and it's the people who deliver great care, and we all honour them. Thank you.
Well, thank you, Debbie. As you can see, that's been a extremely a busy period, but an excellent summary. So thank you, Debbie, very much. Now I'd like to invite Pete Papworth, our Chief Finance Officer, to talk to us about the finances during the 6 months that we're reporting on today. Pete.
Thanks, Philip, and good morning, everyone. I'm absolutely delighted to be here today at UHD's first ever annual members meeting. We've just heard from Philip and Debbie what a truly exceptional year it's been for our trust, and I just wanted to take a moment to express my thanks to every single member of our team here at UHD for everything you've done and continue to do to support our patients and each other. I feel incredibly privileged to work alongside you all. Now, it's my role today to provide an overview of our accounts and financial performance, and again I owe a great debt of gratitude to our finance team and our much wider team of budget holders who have responded so positively to the interim arrangements put in place both nationally and locally to ensure that the highest possible standards of financial control were maintained, whilst ensuring that these were sufficiently agile to avoid delays in our clinical and operational response to the pandemic. If I could have the next slide, please, Zoe. A massive amount of work has been undertaken to implement our new finance systems and processes for our new trust, and this has allowed us to confidently prepare our annual accounts, complying with all relevant accounting standards and national guidance. And it was really pleasing to have such a positive report from our external auditors, providing an unqualified, so a clean opinion on our financial statements, confirming that they provide a true and fair view of our financial performance for the period, and that we have appropriate arrangements in place for securing economy, efficiency and effectiveness in the use of our resources. Next slide, please, Zoe. From a financial perspective, the UK government was explicit at the outset in its support for the NHS, with the Chancellor confirming that the NHS would get whatever it needs, whatever it costs, to deal with the coronavirus outbreak. And almost immediately, the entire finance regime in the NHS was suspended and national interim arrangements were put in place. Over the course of the full financial year, so UHD and also its predecessor foundation trusts received £73 million through these national interim arrangements. 22 million of this replaced national sustainability funding that would otherwise have been received, meaning that we received an additional 51 million in funding over the full year. 27 million of this was spent on specific additional COVID costs, with the remainder supporting our underlying financial position, including recognition that during the pandemic we were unable to deliver the cost improvement programmes that we had planned to. It's important to highlight that our COVID expenditure of 27 million largely excludes the cost of personal protective equipment, which was procured nationally and distributed based on need. Again, looking at the year as a whole, UHD and our legacy trusts set a very ambitious capital programme, and Debbie's given some context around that, and we were very fortunate to secure additional capital allocations as the year progressed. This resulted in a total capital expenditure of 71 million over the full year, 47 million in the period of this annual report, and 31 million over the full year was spent operationally, maintaining our IT and our estate and supporting our medical equipment replacement programme, with 40 million supporting our strategic developments and allowing us to keep pace with our transformation programme. We continued to pay our suppliers in a timely manner and ended the year with a strong cash balance of £98 million. However, it's really important for me to emphasise that this has been built up over many years as part of our long-term financial strategy and is fully committed against our future reconfiguration programme. If I could have the next slide, please, Zoe. Turning to the current financial year, we've seen the continuation of national interim financial arrangements, and we're currently forecasting a balanced position for the period to 30th of September. This includes 12 million of specific COVID expenditure, with an additional 9 million spent recovering our elective waiting lists, supported by the National Elective Recovery Fund. We welcome the government's recent announcement confirming an additional 5.4 billion for the NHS for the remainder of this year, and look forward to the detailed allocations which are expected imminently. We do know, however, that this will include a very significant efficiency requirement, making this a very challenging period financially, and we'll shortly be refreshing our financial plans in line with those allocations. We're currently on track to deliver our full year capital programme, again a very significant programme supporting our operational requirements and progressing our strategic developments, and I'm absolutely delighted that our £200 million acute reconfiguration full business case has now been approved by the Department of Health and Social Care and NHS England and Improvement Joint Investment Committee, and we're very much looking forward to Treasury approval in the coming weeks. Of course, it would be remiss of me not to highlight that our current interim arrangements are masking a very significant underlying recurrent financial challenge, and our focus going forwards will be on addressing this in collaboration with our Dorset partners. Next slide, please, Zoe. So in summary, we have continued to manage our money well, and we've been supported by strong governance arrangements. We've benefited from the national funding and welcome the confirmation that this will continue for the remainder of this year. We do continue to benchmark incredibly well against a range of key financial and productivity metrics. However, our financial position remains incredibly challenging and will require significant focus to ensure that all financial savings opportunities are maximised both internally and across our integrated care system. Final slide from me is one I can't leave without emphasising, and this shows that in everything we do, we are always guided by our finance risk appetite statement, and that's on screen now and makes clear that the safety of our patients takes precedence over everything else, and we will never compromise patient safety to deliver within our financial plans. So thank you. I'm going to stop there, Philip, and I think I'm handing over to Sharon now to provide an update on our membership and governance.
Well, thank you, Pete. Pete and his team are to be congratulated on what they've achieved so successfully in bringing two sets of financial systems together, two sets of accounts together, and all of this against the backdrop again of the COVID pandemic. So congratulations to Pete, and also we should thank our external and internal auditors who have had to work in a very different way over the last year to that which they're familiar with. So thank you to you all. Now I'd like to invite Sharon Collett, our Deputy Lead Governor, to give us a presentation from the Council of Governors. Sharon.
Thank you, Philip. Well, good morning, everyone. As you can see, I'm Sharon Collett, and it's a great privilege to share information about Governor activity and membership for a few minutes this morning. Next slide, please. Governors were elected by members following merger of the Royal Bournemouth and Christchurch and Poole hospitals, and we commenced working together in January this year. A number of us were governors previously and were re-elected, and we have also welcomed new governors. You can see the areas we represent, and we are also fortunate to benefit from the perspective of staff governors and governors appointed as a result of partnership working. Together, we form the Council of Governors. So let's remind ourselves why we have governors. Next slide, please. This is a different role from a school or college governor, as we represent the interests of members of the Trust and the public. We inform the community of the work of the Trust. We hold the non-executive directors to account for the performance of the board, and we maintain the highest standards of governance. If you're a foundation trust, as we are, you have to have the highest of standards, and governors help to realise that expectation. Next slide, please. As you can see, significant activity has taken place this year. It couldn't have been more challenging or exciting. It's not every day that we appoint the chair and the non-executive directors and improve the appointment of the chief executive, who has just spoken to us with such warmth, positivity and eloquence. Next slide, please. Governors also receive key documents and benefit from high quality training, often jointly with board members. Governors bring skills, knowledge and experience and undertake their duties conscientiously and with gravitas. I want to acknowledge this, and David, lead governor, and myself as deputy are honoured to have been elected by such able governors. Next slide, please. An important part of our role involves recruiting trust members, and we plan events with our communities in mind, although, as you would recognise, we've had to keep everyone safe during the pandemic, so have been a little restricted. Despite constraints, governors emphasise to the board the need to stay connected to you, our membership, saying no matter what, it's a priority to inform and serve trust members. Next slide, please. This event took place as a result of much perseverance, and over the course of 2 days, governors ensured many new members were recruited and good conversations took place. In particular, we were able to provide clarification and information about developments at UHD, and many of those who visited the stand asked for their thanks to be relayed to NHS staff for their return to good health. Next slide, please. We are thrilled to have so many members engaged in the work of the Trust. It has been and remains a time of challenge, but there is much pride in the talented and committed teams who have carried out their roles under such extreme circumstances. Many have paid tribute to the NHS, not least the red arrows emitting blue plumes of smoke across the beach at last week's Air Festival. You may have experienced the developments taking place across hospital sites, and whilst it may have resulted in some challenges, the excitement of being able to make significant improvements in services for the residents of Dorset is immense, and those leading this work deserve our gratitude and our support. As you can imagine, governors are very much looking forward to a time when it is safe to stop being a virtual team and to meet in person. Next slide, please. We're committed to ensuring membership represents our population, and we always consider how we can achieve that. For example, we try to focus on activities which can broaden the age range, reach different communities, and facilitate those with disabilities and learning challenges. A truly inclusive approach. This requires continual focus, but if we are to ensure representative voices are heard, it is essential. Next slide, please. If you're not already a member, you can see here some of the ways your involvement is beneficial, including monthly e-newsletters and magazines and attendance at informative events. All are excellent. If this interests you, please contact us using the email at the bottom of this slide. If you're already a member and we don't have your email, please forward this as a priority and help us reduce costs. Governors have had to find different ways of engaging in the past year due to COVID-19, but we've continued to represent the views of members and the public at the Council of Governor meetings. Just a reminder, it's not the role of governors to respond to specific complaints, as this is one of the functions of PALS, the Patient Advisory and Liaison Service. If you contacted this service, you'll know how much support is available. Next slide, please. And finally from me, please make a note of the different ways you can contact governors. We'd love to hear more from you. Thanks for listening and enjoy the rest of the day.
Thank you, Sharon. The governors are such an important part of the governance of the trust and contribute so much. So thanks to you, to David Triplow, and all your colleagues. Now we are going to have an opportunity to respond to any questions that we've received from members. We just wait for the team to put those up on the screen. I know we've had two in advance, and just waiting to see whether we've got any more. So if you've got any questions, please submit them now to us. Okay, so from a member of the public, we have a question about about patient engagement, and I'm going to ask Paul Showbrook to respond to that, please.
Thank you, Philip. Good morning, everybody. My name's Paula, and I'm the Chief Nursing Officer for UHD, and it's a delight to be with you this morning. So thank you. I'm going to read out the question from a member of the public. I see you have a fairly strong patient experience team, but notwithstanding COVID, are patients actively involved, engaged, given a voice at every level, from frontline through to operational to strategic? That's a really great question. Thank you so much. It's something really dear to my heart. And it's been an absolute focus for us, and it has been more difficult with the COVID pandemic, but I have to say it has given us opportunity to do things a bit differently, like today, for example. We've got used to technology in a way that I never thought we would, but just some examples now. So just in terms of frontline and, you know, what does that mean as a nurse on the ward or a doctor or another member of staff? Absolutely. I mean, the focus for us and the absolute importance with our values is to treat every patient as an individual and to make sure that we're hearing their voice when they come into any of our hospitals, to know what they want as an individual, and also to work very closely with their family and their carers. But also we've got some more formal ways of doing this. So for example, anybody that comes into hospital, if you come into the emergency department at Bournemouth or at Poole, or if you come into the wards, we ask for feedback. And if you're a patient, we really value that. It's called the Family and Friends Test. And that's reviewed by our ward teams to see what patients are saying and helps us improve our services. Clearly all the time we're wanting to improve. Operationally, we use all of that feedback to think about how we develop our services. So it is really important that we get patient feedback, but also we work alongside partners, patients as partners. So for example, some of our services work closely with patients to develop. Some of our cancer teams do that. I have a patient partner, Rosie, if you are watching today, hello, because I listen to what patients say to find out how we're doing with our services. And then really strategically, I mean, Debbie's already outlined some of the really important work that we're doing. So this is our planned hospital and our emergency hospital. And I've been working alongside some of the clinical teams with this. but importantly, we're wanting patients and we're working alongside patients now as we develop, for example, our maternity hospital. You know, what works for a patient when you're in a maternity hospital? What is best practice from their perspective? As we're developing our critical care, what does that mean for our patients and how can we do things differently for the future? And I think for me, that's one of the most exciting pieces of work we're doing, working alongside our patients to develop things to be better in the future. So we have had some constraints, you're absolutely right, with COVID. It's an absolute key priority for us. There's more work to do. The patient experience team is part of my team, and for that team, for our staff and for our board, it's a key priority. So thank you so much for that question. Thanks, Philip.
Thank you, Paula. We have another question that was kindly submitted to us in advance, which I will read out and then ask Pete Papworth to respond to. So, under the Equality Act 2010, sex is a protected characteristic and gender is not. With this in mind, how can UHD comply with the Equality Act while being signed up to Stonewall's Champions scheme? Pete.
Thanks, Philip. And firstly, I'd just like to say thank you for the question and for raising this issue, which is such an important issue and one we take very seriously, given our genuine desire to provide truly inclusive services for our patients. Debbie's talked about how we developed our new organisational values following merger, and you can see those at the bottom of the screen now. And inclusive is absolutely one of the values that all of our staff very, very strongly about. And we were really, really delighted to see come through that process as a board. We are currently a member of the Stonewall Diversity Scheme. However, as you would expect, this represents just one of many sources of advice and guidance accessible to the Trust. We are, of course, aware of the debate about this topic at present, and we're keeping abreast of this. All of our policies are being reviewed following merger to ensure that these are up to date for our new organisation. And specifically, we've recently reviewed and updated our privacy and dignity policy, our single-sex accommodation policy and our transgender guidelines, which are now progressing towards formal approval through our committee structure and will be published on our website shortly. In updating these policies, we've taken expert legal advice from our solicitors to ensure that these remain fully compliant with all of the relevant legislation, but also the appropriate legal precedent that is being developed day by day. Importantly, in developing these policies, our staff, our patients and members of the public have been involved to ensure these are fully updated and appropriate for our new organisation. I do hope this gives some reassurance that we understand and we do take our responsibilities very seriously, and we do make every effort to provide compassionate services for all of our patients.
Thank you, Pete. Now we have a very topical question, which I'm going to ask Mark Mould, Chief Operations Officer, to respond to. How are you going to tackle your long waiting lists?
Thank you, Philip, and good morning, everyone. Really happy to be with you today. I suppose the first thing in terms of tackling our waiting list is firstly to thank our staff and our patients for the support they've given over the last period. As we went through COVID, our focus had to be on emergency work and urgent work, and that did mean our elective work had to stall, stop or slow down. What that's meant is we have an increasing number of people waiting. But first thing I'd like to say, Philip, is we're making progress on reducing down those numbers of people waiting. Just to give one indication, at the peak of COVID, we had 5,000 people waiting over 52 weeks. Over the last 4 months, we've seen that number come down to just over 3,000. Clearly 3,000 too many, but we're making significant progress around using our theatres better, using the independent sector, looking at alternate work in the evening and at weekends, And also, Debbie talked a little bit about our Think Big project. So we're looking at every opportunity of being innovative, creative, and ensuring that patients get in front of our clinicians, so our clinicians can make a decision on the patient pathway, whether that's to progress to treatment, diagnostics, or whether it's revert back to primary care and self-care. Final thing I wanted to say, Philip, is the intention of the organisation is to continue to maintain the focus on reducing waiting times down, and collectively as a board we're committed to do that. And I just wanted to say to our patients out there, we're spending a lot of time sending information to patients to ask them a number of questions around their experience and time on the waiting list. But the biggest question of all is, we know that you're waiting, we are aware of you, and we are doing something to address your need. Thank you.
Thank you, Mark, very much for that answer. Now, I can't see any more questions. This is your final chance before I bring the meeting to an end. If there's any pressing question you'd like to put the team today, I'll just wait a few seconds to see if anything comes through. Debbie would like to say something.
Yeah, I know that one of the questions that I've been asked, I just wondered if Alison could just say a little bit for us about perhaps the benefits of the university hospital status, which we haven't, we always have to touch on so much. And I would like to have said a bit more, so I wonder if Alison could just say a bit more about that for us.
No, thank you, Debbie, and I think that is one of the things that is very exciting about the developments that we've been involved in over the last 12 to 18 months or so, and it's really great because we are in that situation now where we now have John Vinnie from Bournemouth University sitting on our board, and we have and we are also sitting on the board of Bournemouth University, so really trying to pull those relationships together. And it really is providing us with a lot of opportunities. One of the biggest issues that we're having to address is about how do we get a workforce that's going to be able to take us through managing the backlog, continuing to work in a different way, and that close working with Bournemouth University is giving us opportunities not only in continuing the professional development of our staff who are already working for us, but think about bringing on additional roles that are really helpful to strengthen our workforce. So, for example, last year we had the first cohort of physicians associates who came out, and they're a really new group of individuals who are new to the health service. So it's not about us recycling our staff into different roles. So very exciting, lots of opportunities there. I think the other thing that we have is the potential to completely change patient pathways using the expertise that Bournemouth University has, to really think differently about how we care for patients. And finally, and not because it's the least important, the opportunities that we have around research, and we're already seeing lots of developments around that, and looking at innovation hub status, which is going to bring more finance into our system, and again allow us to really push that quality improvement, doing things differently, much further and faster than we otherwise would be able to under normal circumstances. And we shouldn't underestimate the benefits of all of those bits of what we're doing with the university hospital, because I think that it's fair to say, and I think probably most people around in the virtual room today have got experience of this within their own teams, but we are undoubtedly attracting a really high calibre of candidates when we go out to advert for jobs, and people coming to us. We've had a big influx of people who have come to us from London, for example, from some very big hospitals in London, because they see the opportunities that this presents, and that can bringing new blood in, bringing new ideas and new ways of working in can only ever be good for us as an organisation in terms of how we develop, and back to that constantly improving, which we've got again on our behind Debbie's head there in the middle. You can see the always improving. That absolutely sits behind that ethos. So I think it's a really important part of our future journey. Debbie, thank you for asking the question.
Thank you, Alison. And you've touched on this a little in that response, but there's a very specific question that we've been asked this morning about how are you going to recruit enough doctors?
So I think this is a really complicated one, and I think one of the things that I would say is that the historical models of how we ran hospitals with doctors when I was a baby doctor have gone. They've long gone, and it's about having the right people doing the right bits of your care. And historically, a lot of that was done by doctors, and it doesn't need to be. So that's where roles like the physician's assistants, doctor's assistants, our advanced nurse practitioners, our consultant nurses, our consultant therapists, all of those are really important. And so we have to think about our workforce in a much more complicated way than we might have done, where everybody got into the swim lane of their profession and you stayed in the swim lane of your profession. It needs to be much more subtle and much more complicated than that now for us to actually provide really, really good care to people. As I said, I think we've got the attraction of the university, and I think we are actively recruiting overseas where we have got gaps, and looking at the different workforce models which bring people in. And one of the things that I've been doing a lot of work on is about how do we use our money better, which I know makes Pete happy. So how do we use our money better so that we're not actually working our own staff harder, running fast to stand still because we've got all of this work that we have to catch up on. How do we get that different workforce that are our sustainable workforce that are here to work for us, hopefully for their career, and just makes that much more robust and resilient when we do have these peaks and pressures. And I could see that Paula popped her hand up, so I think she may have a comment to add on to that.
Thank you, Alison. Anyone that's working in the trust will tell you that this is a brilliant place to work. I absolutely love working with colleagues in this trust, and actually one of the great things being able to meet people at open days is to be able to really describe what we do in the hospital. We've got so many opportunities to be part of the community, to be a good employer, and Alison and I talk a lot about doctors' roles, nurses' roles, but actually more broadly there are some fantastic opportunities for staff. And one of the things we talked about, patient experience and public engagement earlier, part of my team have been going out into the schools and really saying about all these different careers that we can offer as University Hospitals Dorset. So if anyone is interested in this, then we'd be delighted to have further conversations. The NHS is a brilliant organisation to work for, and I'm really proud to be part of it, and we'd love you to join the team.
Thank you, Paula. And there's a couple of questions which perhaps you'd like to take together, Paula, about the length of time it takes to train nurses, but you really need them now. So how do we fill the gap? And then what is the ratio of agency staff to salary staff? And
so I'll start and I'll hand over to Peter in terms of the ratios of staff. But yeah, absolutely right. I mean, it takes 3 years to do nurse training, and we work very closely with the university to train our nurses, which is the focus of this conversation, the focus of the question. We have a variety of ways of getting skills into our hospital so that we've got really good ward-based care. So some of those, it of course is the registered nurse. So working closely with Bournemouth, Alison's already described part of our partnership working is absolutely critical. Also, we've got other ways of getting nurses in now. So, for example, we've had 125 international nurses come over, international recruits, since we have launched UHD, and we've got a further 75 international nurses who are joining us by December this year. So that's fantastic news, and that immediately helps support alongside our teams. We've also got a raft of support workers. So our healthcare support workers are absolutely amazing. They are very well trained, skilled staff to help support our patient care. And part of the exciting sort of opportunities within the NHS is to progress. So people that can come in as a healthcare support worker, band 2, band 3, we provide training on the wards. We now have a registered nurse degree apprenticeship. So that's another way of getting your registered nurse training so that you're on the wards, getting trained, but also having that liaison with the university. So there are a number of opportunities to be able to take forward for this. And I'm going to hand over to Pete about the agency side.
Thanks, Paula. And I won't repeat all of the great work that's happening locally in terms of recruitment, both in terms of nurses and also in terms of our medics. The workforce shortages are a national issue. It's not a local issue to us. And I think we're responding well. We are much better placed to respond now. We are a merged organisation, and also with our university hospital status, we are a very attractive organisation now to come to work to, and that's absolutely fantastic. Just picking up on the specific question around the ratio, I can't do that. I don't have the figures at my fingertips to do that in terms of headcount or whole-time equivalent. But from a financial perspective, our pay costs are around 65% of our total costs. And within our pay costs, our agency expenditure is about 3% of our total pay expenditure. Now, that is higher than we would like. We would clearly dearly love that to be zero. We would normally expect that to be around 1 to 2%, and that's what we would be striving for. But currently, it's about 3% of our total pay bill.
I feel like, just to sort of follow up on that, one of the pieces of work that I've been doing, you know, referring back to that sort of not wanting to be working our staff harder to have substantive staff, is that we've halved over the last 3 years. We've halved the amount of our medical workforce spend that is spent on overtime, bank shifts, an agency, and the agency is a small agency. Locums are a very small part of it, but we were spending quite a lot on bank and waiting list initiative payments, which are our own staff, and we've managed to halve that in the last 3 years as a percentage of our spend. So I think we're constantly looking at how we get better value from our workforce spend, which but the added benefit of that is not just about better value for money. It means that we're not overworking our staff and asking them to go above and beyond and burning them out and making them tired. So it's a bit of a virtuous circle when we have that mindset and approach to how we get that substantive workforce in place, not relying on these other ways of paying people.
Thank you, Alison, Paula, and Pete for the answer to those questions. Well, we don't have any further questions, so I think we will close the meeting. Thank you for participating. Hopefully next year we'll be able to meet in person again. I'd like to thank the presenters and all the team at the Trust working in the background today who have made this meeting possible. So thanks to you all. And a final thanks to Debbie, the executive team, and all the amazing staff, volunteers and partners at the Trust for all that you do. Thank you so much. Now, today we're holding the Trust's Open Day virtually. There's some wonderful events that have been created for today. So please do dip in to these and enjoy these events, and you can access them via the homepage of the Trust's website. So just remains for me to say thank you once again and goodbye.